Want to welcome to the program with the Doctors for Responsible Gun Ownership, Dr. Timothy Wheeler. And Dr. Wheeler, thanks so much for coming on the program this evening.
Thanks for having me on, Cam.
You bet. All right, so up in Boston, we've got the American Academy of Pediatrics meeting, and I guess they unveiled a new study here today, or yesterday, a new study based on the National Hospital Ambulatory Medical Care Survey. And they say that the rate of non-fatal firearm injuries in children, which, by the way, kids is defined as those aged 19 and younger in this study. The rate of non-fatal firearm injuries is 30% higher, they say, than previous estimates. Now, have you had a chance to take a look at this, Dr. Wheeler?
Well, I saw the CBS News report online, Cam. I looked for the original article. It's just not available yet. So we'll have to go by the CBS report. But most of the facts are there, and there's nothing surprising here. As you said, this study of so-called children includes kids up to age 19, which includes a demographic that oftentimes we don't think of as kids. Mm-hmm. And more than a third of these injuries, 37% of them, were unintentional. That means that the other 63% were intentional. A big chunk of those, we know from previous studies, are suicides, but the rest of them, which is a pretty good chunk itself, are homicides. Now, when we think of kids, we don't usually think of kids going out and committing homicides with guns, but this study does include that group. The study itself says who's most likely to wind up on the wrong end of a gun, and I'm quoting, "Not surprisingly, the study shows that it's adolescent boys." No surprise there. Blacks in particular, no surprise there. There are a million previous studies that show all of this, so this is not surprising.
Okay, do these statistics, because, you know, to me, Dr. Wheeler, I mean, it seems like what they're trying to suggest here is they're trying to remove the element of criminality from the equation. In fact, there's, you know, the study author, Dr. Srinavasan, said, quote, "We know that there are certain pediatric populations at higher risk for firearm injuries. We hope this research will bring attention to the issue of pediatric firearm injuries and that we can continue to focus our efforts on firearm injury prevention campaigns." Well, again, if a lot of this is, let's say, intentional, we're talking non-fatal firearm injuries. If a lot of this are, you know, gang members going after one another, or gang members going after somebody and missing their target. Oh, I think we lost Dr. Wheeler. We'll try to get him back on the program here. Anyway, if you're talking about criminal acts, that to me is a much different thing than talking about accidental or unintentional injuries. They, again, 37% of these injuries, they say, were unintentional. That would mean that the vast majority of them were intentional or criminal in nature, specifically when we're talking about people harming others. It looks like they're really trying to take the criminality out of this and to make this a public health issue.
Well, Cam, that's what these folks have always done from the American Academy of Pediatrics and all of the so-called advocacy researchers, the anti-gun advocacy researchers in public health and medicine. You can bet that the kids in this study who sustain firearm injuries or deaths are not the kids who shoot the junior rifle event out at your local gun club. Mm-hmm. This is a very, very different demographic. What I would like to see is the American Academy of Pediatrics actually study kids just like that. You know, the kids who do shoot junior rifle and who shoot Olympic guns and who shoot firearms out at the range under the direction of their fathers or other responsible adults, and see what it is about those kids that makes them basically immune to firearm accidents. I would love to see the American Academy of Pediatrics study those kids and give us a good report. Somehow I don't think they're going to do that, because really what they're after here is to show a shocking bad thing, that there are even more kids than we thought who are getting injured by firearms. And therefore, well, guess what we need to do? We need to continue advising patients to never have a gun in your home.
Right, despite the fact that if you actually looked at the people who are being injured here, again, in many cases, what I think you'd find is that there are a lot of behavioral choices that these individuals are making that perhaps might increase their risk of being injured by a firearm.
That's right. And a lot of these kids come from homes where any kind of responsible behavior is not taught, much less having to do with firearms. They learn about firearms from their buddies out on the street and not from their fathers, not from a responsible adult. And that's a sad thing. But we should never, ever make the mistake of thinking that these kids are representative of kids at large in America.
Yeah, as a matter of fact, and I don't have the study right in front of me, but I remember reading a study, it's probably been 3 or 4 years ago, maybe this rings a bell for you, Dr. Wheeler, that looked at, and I think it was youth hunters, and it looked at their rate of arrests, their rate of, criminal behavior, and again, not surprising, these are some of the best kids out there. They're the best behaved. They're not getting into trouble with the law, and yet these are teenagers and youth who are both familiar with and are responsible around firearms.
And that only makes sense. There is a study, Cam, that was done in 1994, actually a federal Department of Justice study that showed, in 1994, that showed that kids who were taught about guns by their parents, usually their fathers, actually had a lower rate of delinquency than kids who didn't have anything to do with guns at all.
Really? But again,
Really?
it's that I think you could also make the case that, if you've got a good parental relationship, if you've got parental involvement, and if you're doing things like, taking the time to teach your kids about responsible gun ownership, you're probably taking the time to teach them how to be a responsible teenager and a responsible adult.
And that is the core truth right there, Cam. You nailed it.
Well, and so to that end, it almost seems like, Dr. Wheeler, we're making this a gun control issue when, in fact, perhaps we need to be looking at what type of lessons these youth and teenagers and young adults, because I consider 18 and 19 to be a young adult, what kind of upbringing they're getting, frankly.
Exactly. And again, we wait for groups like the American Academy of Pediatrics to start being honest and to make that distinction and start looking at both sides of this. But since they already have an anti-gun political agenda, it's not likely we're going to see honesty from the American Academy of Pediatrics anytime soon.
Yeah, I fear that you are right. Well, listen, Dr. Wheeler, again, glad you could be with us on the program, and let me know if you see any other additional anti-gun studies heading your way.
I will do that, Cam. Thank you very much.
All right, have a good night. Dr. Tim Wheeler joined us with Doctors for Responsible Gun Ownership here on NRAnews.com and Sirius XM Patriot.